Hello, my name is Alireza Shamaei-Tousi. I'm Principal Clinical Scientist at the Biopharm in Switzerland. Bone and joint infections include prosthetic joint infection, osteomyelitis, and septic arthritis. And most of the osteomyelitis cases are actually caused by staphylococci. The usual recommendation for bone and joint infections are long-term antibiotic treatment and also appropriate surgery. However, there is up to 40% risk that the patient actually have a relapse, and this means that there is an unmet need for alternative and possibly a better antibiotic in this place. Afabicin is a staphylococci-specific antibiotic and a first-in-class Fab-I inhibitor. Fab-I is essential for bacterial fatty acid biosynthesis, and afabicin inhibits Fab-I, and thereby it's inhibiting bacterial fatty acid biosynthesis and preventing bacterial growth. This is an open-label phase 2 study to assess the safety and efficacy of afabicin for treatment of bone and joint infection. In the first completed cohort in the ongoing study, patients received 2 to 3 weeks of treatment of afabicin or standard of care. The afabicin efficacy results were similar to those to standard of care. We had similar treatment emergent adverse event. However, none of these were treatment related. The efficacy was assessed at end of treatment, at 4 weeks after end of treatment, and also at 12 weeks after end of treatment, which is also end of the study. And efficacy was based on improvement of disease-specific signs and symptoms. What we saw was that in afabicin we had 100% response rate at end of treatment, which is great. And we had also the similar figure for standard of care. Also for 4 weeks and 12 weeks after end of treatment, we have over 86% response rate for afabicin. Still very good data, and we also had the similar numbers for standard of care patients. So overall, in this completed cohort, we can see that the safety profile for afabicin was very similar to standard of care. But more importantly for us, we could see that we had 100% efficacy at the end of treatment, and overall a very good efficacy result in that cohort. This has been very encouraging, and also we have now already initiated cohort 2, which is recruiting patients for 3 to 6 weeks of treatment.